Hello, my name is Peter Harvey, and I am doing the adult physical head-to-toe assessment for the assessments class for West Texas A&M University. The patient that I have today is Stephanie. She's a 27-year-old female. We've already gone through some of her health histories and taken her vital signs, which are within normal limits. Health history includes history of migraines and knee problems, right? Osgood Slaughters as a child?
Mm-hmm.
Okay. Also, Stephanie has got allergies to aspirin, to Vicodin, and to Demerol. So since we've already gone through the rest of the interview, I'm just going to kind of start with my physical assessment, and we're going to start at the head. I'm going to inspect the scalp and the hair, and right away I notice that the hair, it's not brittle. I don't notice any patches of missing hair or thinning hair. The scalp is healthy. I don't see any dryness or flaking or peeling or open cracks or breaks in the skin. And when I palpate the skin, everything feels symmetric and normal. Same thing with the forehead. And I'm going to take a look at your eyes. I'm just going to inspect them first and pull your lids down a little bit. I don't notice any sort of edema under the eyelids. The sclera are white and the conjunctiva is nice and pink. I don't notice any discharge. There's no yellowing of the sclera. There's no redness to the eyes. It looks very normal on exam. And I'm going to take a look at that with the light, if that's okay. Good. So, first, using my left hand, I'm going to go to the left side of your face, and I'm just going to put it up right nearby and take a peek in with my left eye. And I'm looking for that red optic disc, and there I can see that. And moving on, I'm going to do the other side. My right side to your right side, and there I can see that. Good. And I'm going to check the pupils to make sure they're equal, round, reactive to light, and they accommodate, okay? So first I'm going to shine a light in there, and you're going to see if your pupils constrict. So shining that light, I see that constricts from about 4 millimeters to 2 millimeters. And I'm going to bring it from the side, do the same thing. Good. And going to the left eye, I notice also from about 4 to 2. Good. And then I'm going to check your ocular movement. This is going to check cranial nerves 3, 4, and 6. And so I'm going to hold my pen out, and I want you to hold your head still and just follow my pen with your eyes, okay? So hold it right here. And I'm looking for any breaks in the vision or any nystagmus, and I'm not seeing that. And then starting from here, I'm going to bring my pen inward, and I'm just going to check to make sure that your pupils, number one, constrict when I bring that in, and make sure that your vision doesn't break when I bring that in, okay? So going in, kind of close. Good. All right, that's good. And I'm going to put this away because I'm done with that for now. And I'm going to move on to your ears real quick. So first, looking at your ears, I don't notice any asymmetry to the ears. They're nice and equal. And I'm just going to feel along those auricles. I don't feel any nodules or anything. Do you feel any tenderness there? No? Okay, good. We're going to put the light on, and I'm going to take a look inside those ears. And I'm going to be looking for any redness, dryness, buildup of wax inside the ear, or any fluid buildup underneath that membrane. I'm going to pull up real lightly on the auricle of the ear, take a look inside, and good. That looks nice and moist. There's no bulging of the membrane or anything. I'm going to come on to this other side and do the same thing. Pick up real gently, and then just take a look inside. It looks the same here, so nice assessment of the ears. And we're going to move on to the nose. And first thing I'm going to do is I'm going to try and plug up one of your nares with my hand. I just want you to breathe through your nostril, make sure that we can breathe equally through that. So deep breath in and out. Good. Good. So it looks like both nostrils are patent. Not real suspicious for like a septal deviation or anything. I'm just going to shine a light in there as well. Just make sure that the mucosa is pink and moist, not dry or cracked. right away, just looking at the nares right underneath the nostrils, I don't notice any breaks in the skin. It looks appropriate coloration for the rest of her body, nice and pink. And I'm just going to take a look inside. Good. I don't notice any redness or discharge here. So maybe just a tiny little bit of redness there. And then we are going to move on and take a look at the mouth here. So also going to check cranial nerves 7 and 10. So while I'm at it, can you raise your eyebrows up for me real wide? Good. Can you puff out your cheeks? Good. All right. Go ahead and open your mouth real wide for me here. And I'm just going to use my light to help me kind of take a look at that oral mucosa. I notice that the lips are nice and moist. They're not dry, cracked, or bleeding. I don't notice any ulcers. So take a look inside of that mouth. Good. So I can see the palate. Oral mucosa looks nice and pink. And I don't see any cracks or breaks in the teeth or anything like that. I'm going to take my tongue depressor. And can you stick out your tongue for me? Good. Can you say ah? Ah. Good. And I'm just going to check the gag reflex real quick. So I'm going to test right back there. Good. Good. Sorry about that. One more thing. Can you stick out your tongue and wiggle it back and forth for me? Good. And if you pick your tongue way up, I'm just going to take a look at those vessels underneath the tongue. Good. I don't, looks like the vascularization is good. I don't notice any sores or lesions underneath the tongue. And so we can move on from the mouth here. I'm going to take a look and I'm just going to kind of palpate the lymphatic system here. So I'm going to start kind of top. I'm just going to press real gently. I don't want to press too deep because it can be real easy to miss some stuff. Go underneath, back by mandible, bimaxical, deep cervical. And I'm just going to go down the neck a little bit. And can I have you raise your arms up? I'm going to test the underarm ones. Might tickle a little bit. Sorry. And then one more, just kind of right in there. And so I don't really notice any enlarging of the lymph nodes. Everything feels pretty normal there. So I am going to have you go ahead and raise your shoulders against my hands here. That's what I meant to. There you go. Good. So good shoulder muscle tone. It looks like you can actually move against resistance. And I'm going to move along to the back side, and I'm going to begin my assessment of the chest, starting with the posterior. Actually, you know, before I do that, let's go ahead and test some hearing stuff with your ears. I just kind of want to test for some hearing loss. So we're going to perform a whisper test, and then we're also going to do the RIN test, which is going to help measure for like conductive hearing loss. So I'm going to come around to this back side, and first I'm going to whisper a couple words to you, and I want you to try and repeat the words that I whisper, okay?
88. 74.
Good. Down this side.
27. 33.
Okay, good. And now we're going to move on to the RIN test. And so I'm going to hit this tuning fork. I'm going to put it back right about here. And I want you to tell me when you stop hearing the tone from the fork. And then I'm going to move it up to the side, kind of lateral to you here. And I want you to tell me when you stop hearing it on that side as well, okay?
Okay.
All right, so strike kind of against my forearm. I'm going to put it right up against the back of the occipital area there.
Done.
Okay, and moving to the side.
Done.
Good. And same thing with the other side here.
Done.
Good. And one more.
Done.
Okay. All right, so I'm going to set this over here. And first, I want to kind of inspect your chest. Do you mind pulling up the back of your shirt just so I can get a good look at the back of your chest? All right, so looking at the back of the chest, everything looks symmetrical. Can you take a couple breaths in and out for me? I just want to make sure there's good. I see equal rise and expansion of that chest. Do you mind turning your back to the camera a little bit just so they can see what I
Sure.
see here? Okay, good. So go ahead and breathe in. So notice there's no asymmetry to the chest. There's good expansion. Ventilation here. Good. You can turn back around here and then we'll take a listen to your lungs. And I apologize if the stethoscope's a little bit cold here. So, deep breath. Oh, let me flip that around. Sorry. There we go. Okay. Breath in. Good. Again. Good. Again. Good. Again. Good. Again. Good. Again. Good. More. Again. Good. Again. Good. And then I'm just going to check for some palpable firmness. So I'm just going to kind of feel lightly along your back, kind of along your lung lobes, and I just want you to repeat the words 99 for me, okay?
Okay.
Go ahead.
99.
Okay.
99.
Okay.
99.
Good.
99.
Okay, good. And then I'm going to listen. I'm going to have you do the same thing in a couple of different spots. And then we're going to do one more test where I'm going to have you say E for me real quick, okay?
Okay.
Okay. Go ahead, say 99.
99.
Good.
99.
Good.
99.
Good.
99.
Good. Now say E.
E.
Good. E.
E.
Good. E.
E.
Good. And E.
E.
Good. All right. So a little bit muffled with the 99 for the firmness, and then those E's are nice and clear. I didn't hear an A sound, which is would kind of be unexpected and abnormal finding for us. And while I'm out here, I'm just going to check for some renal tenderness here. So I'm just going to give you a couple little thumps right back here. Okay. So. Do you feel any tenderness back there?
Nope.
Okay. And I'm going to do a little bit of percussion while I'm at it as well, just to make sure I'm really nice and thorough. Listen for any areas of excessive resonance or dullness. If there were a lot of resonance in there, I might be worried about some respiratory symptoms, asthma, COPD, stuff like that. If there were a lot of dullness in there, I'd be a little bit more worried about like fluid buildup in the lungs. So that's kind of what we're assessing there. I'm going to move along to the front side. I'm going to assess the anterior chest. And I'm going to listen to your lungs first. So go ahead and take some deep breaths for me. Good. 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 And we're just going to go to the sides. Good. And more. Good. And I'm going to listen along the same spots, and I want you to repeat those words 99 for me, okay? Okay, go ahead.
99.
Good.
99.
Good.
99.
Good. Get.
99.
Good.
99.
More.
99.
Good. And I'm going to listen to our heart tones while I'm here, just start part of my cardiovascular assessment here. So listening to those heart tones. Then I'm going to go right back around to the side here. And I'm going to go kind of underneath your breast a little bit here for. Good. So I hear kind of the normal S1, S2 sounds. I don't hear any extra gallops or murmurs. The S3, S4 clicks. Everything sounds very normal to me there. Why don't we go ahead and we can move to your abdominal assessment. And I've got the head already kind of set at about 30 degrees here because that's going to allow me to also check for the jugular venous pulse. So do you mind lying kind of flat on your back for me here? Okay. So the first thing that I'm going to do is feel for that pulse. I should say in the middle, I really appreciate Steph coming in the middle of my shift here at 2 a.m. so I can perform the assessment. That's very kind of you. So, so I'm just going to feel for that pulse. Good. And I'm going to take kind of a straight edge and my soft ruler, which I want to flip to where I can measure in some centimeters here. And so, and you want to kind of hold that at a right angle and measure. And usually you want to be no less than 3 centimeters, no more than 8. And we're sitting right at about 5 here. I'm just going to measure that on the other side, make sure that we're kind of in the same spot. And once again, palpating that carotid pulse. Good. And same thing. Gonna put that at kind of a right angle and measure. And once again, kind of right about 5 centimeters, which is an expected finding. I'm going to move back over to this side here and begin our abdominal assessment here. Do you mind picking up your shirt a little bit just so I can get a good look at your abdomen? Good. And so right away, I don't notice any asymmetry. I don't notice any large bumps or any abdominal distension. And I am going to take a listen with my stethoscope. And right after I listen to your bowel sounds, I'm going to flip around my stethoscope and I'm going to kind of listen to your aorta, listen to the renal arteries, and down to the femoral arteries, if that's okay.
Okay.
All right. So first, those bowel sounds. All right. So those bowel sounds are nice and active in all 4 quadrants. And flipping that around, we're going to start listening, try and make sure that we don't hear any bruit going on with those arteries here. First, the abdominal aorta. And then we just kind of down the abdomen. And then go listen for the femoral one. So right about here. All right, good. And so I don't hear any bruit associated with that, so that's a good finding for us. I'm going to go ahead and do a little bit of percussing on the abdomen. And starting with this side here, going to listen. Make sure that we don't have any hyperresonance or any areas where it's overtly dull, and using a percussion technique, you can estimate the and measure the size of the liver, and you can also assess to see if you can percuss the spleen over on this side here, which would kind of be an unexpected finding. It would be kind of extra dull if we end up hearing that spleen there. And I am going to go ahead and start with some light palpation. If that gets tender, let me know, because if it gets real tender, I don't want to move to deeper palpation because I don't want to hurt you, okay?
Okay.
So just starting kind of real light and pressing kind of around the border underneath the ribcage, seeing if I can palpate that liver, which I think we got right about there. And then just going to palpate right around here under that ribcage. I don't feel the presence of the spleen here, and I don't feel any bumps or lumps or anything that we didn't see on the assessment. There's really nothing unexpected that I'm feeling here. Are you feeling any tenderness when I palpate around your stomach?
No.
Okay, are you okay if I palpate, just push a little bit deeper? Mm-hmm. Okay, so pushing a little bit deeper in the upper quadrant, there you can feel that liver. Feels nice and smooth. I don't feel like any nodules or anything on the liver, so that feels nice and expected. And just to the other side, palpate a little bit deeper. Good. Any pain with that? Mm-hmm. Okay. All right, that's good. While I've got you down here, I'm just going to do some range of motion with your hips, kind of passively, okay? So you can just let me do all the work here. So if you can uncross your legs, I'm just going to kind of pick you up at the hip. All the way down. So I'm going to pick you up at the hip here. and flexion, and I'm checking the extension, and then we're going to check for adduction and abduction, and that all looks normal. Move that down, and I'm going to do the same with the knees here. Just make sure that the knees got good range of motion. So up at the knee, and so we got flexion and extension. Do you have any pain with that?
Nope.
No? All right, and so just a little bit adduction and abduction. So internally and externally rotates good. And we're going to go to the other side, do the same sort of thing. So, I'm going to pick you up at the hip right here. And once again, going to extend, or flex, I should say, and extension. Move this way and that way. Good. So, adduction, abduction is normal. And then I'm going to do the same thing with the knee here. So, up at the knee. And so we got flexion and extension. No pain again? Okay, good deal. And so we've also got the adduction, abduction, and then just kind of testing, making sure that I can rotate in and out, and that looks pretty good. Can you go ahead and I want you to push down against my hands like you're pushing the brakes on a car. Good, good. And I want you to do the exact opposite here. I want you to push up. Don't let me push you down. Good. So good strength to those to the pedal muscles here. And let's see, could I have you take off your socks for kind of the next portion of the exams here? Okay. Good deal. So the next thing that we are going to test, you'll swing around here and have a seat. I'm going to just kind of check all of your pulse points here, and then we'll do a little bit of like sensory testing, as well as checking those reflexes. So I'm going to start with, see if I can feel that brachial pulse, which is good. And we already felt the carotid pulses earlier, so those are good, nice and 2+. This is 2+ as well, and the radial pulse is 2+. Ulnar is 2+ as well. If somebody wanted to do an Allen's test, this would be a good time to do that to assess for the patency of blood flow, but we don't need to do that for this exam here, so I'm just going to move on and check your brachial pulse again here. Can you straighten that out for me? There, I got it. And then, once again, the radial pulse and the ulnar pulse, good. And I'm going to see if I can catch those pulse points kind of behind your knees. Good. And then right down here, so these pedal pulses are also 2+. I'm noticing strong 2+ pulses all the way around. Good. And we'll go ahead and test those reflexes, and we'll move on to kind of the sensory portion of the exam, if that's okay. All right, so first thing, if you can hold your arm out kind of like this, we'll test the tricep reflex here. I'm going to use the kind of the mallet end of my reflex hammer, and a little bump here. Good. Good. And then we're going to go around here, check the tellers. Good. That was a strong one, wasn't it? Yeah, one more. Try one more time. Oh, there we go. I missed it the first time, apparently. That's good. So we can move on to do some of the sensory exercises now. What I think I'm going to have you do, can you close your eyes for me? And I want you to hold out your hands. I am going to trace a number onto your hand. I want you to see if you can tell what number I'm tracing on there, okay?
Okay.
All right. So, what number am I drawing there?
3.
Good. And I'm going to do one more on this side here.
7.
Good. And I'm going to put an object in your hands. I want you to see if you can identify. We'll do this test twice. That way you can make sure that we're good on with both objects. So eyes closed. I'm going to put an object in your hand. And I just want you to kind of feel around. There's a lot of objects on my table, so I'm kind of putting a random thing in. I want you to see if you can identify what I put in your hand.
I think that's a key.
Okay, good. And I'm going to do one more, okay? So one more going in the hand. And just feel that for a second and tell me if you can identify what that is.
That's a pen.
All right, good. So sensory is good there. And why don't we're going to assess sensation to soft and to sharp here, okay? So I'm going to have you close your eyes again, and I'm going to either touch your face, your hand, or your toe to something sharp and dull. I want you to see if you can differentiate between what's sharp and what's dull, okay? All right. Eyes closed?
Eyes closed.
All right. Honor system. So, tell me what you feel there.
Dull, kind of dull, I guess.
Yeah, and there.
Same.
Okay.
A little bit more pokey.
Okay.
Yeah, more pokey.
Okay. And can I see your hand? All right.
Pokey.
Okay.
More dull.
Good.
Pokey.
Good.
More dull.
Good. And I'm gonna go move down to your feet. Do the same thing, okay?
Okay. More dull. That one's more pokey.
Okay. And to the other side.
More poke, sharp.
Okay. How about here?
Dull.
Okay. And I'm just gonna test one more time here.
Dull.
Okay. Good. Good. So it kind of covers our sensory portion. One other thing I'd like to do is, since I got your socks off, I'm not worried about you slipping on the floor, I'm going to have you stand up for me, and we'll have you do kind of a heel to toe walk. I just kind of want to assess your balance.
Okay.
Make sure that there's no abnormalities to sensory input here. So can you walk kind of heel to toe?
Mm-hmm.
Good. Good. And Teva, can you just close your eyes for me? And I'm going to kind of push on you from one direction to the other. I'm just going to kind of test, make sure I don't make you lose your balance, okay?
Okay.
So I'm just going to little push. And good. You're holding your balance. You're not losing it, so no ataxia there. And you had a nice steady gait with movement, so that's good. I really only have one more test for you, and can I back you up just a little bit, just make sure the camera gets a nice view of it?
Mm-hmm.
Do you mind if we lift up your shirt for this last part of the exam just a little bit? Because we're going to assess for a little scoliosis or lordosis of the spine. Just make sure that that looks nice and even. Make sure there's no pain upon palpation of that spine.
Okay.
Can you bend over and touch your toes? Good. And so I don't notice any asymmetry to the spine. And I'm just going to press along here. I want you to tell me if you feel any pain or tenderness here, okay?
No, it feels fine.
That all feels fine?
Yep.
Okay, so go up about halfway. Good. And let's do the same sort of thing. I don't notice any change in your spine when I look at it. Does that all feel pretty normal to you? Okay. All right, good. That's good. So I think that this kind of concludes our exam here. Thank you again for coming in at 2:30 in the morning. I really appreciate your help. I appreciate you guys taking a listen. Look forward to the critique when I improve my practice. So once again, I'm Peter Harvey. This is the Adult Physical Assessment for the Assessments class at West Texas A&M University. Thank you.